Now, this is a trial in patients with recent onset type 1 diabetes. These are adult patients that were diagnosed and treated at the beginning of their disease, in addition to insulin, of course, with Ladarixin. Ladarixin is a novel drug that acts on the immune response. Basically, it interferes with some of the mechanisms that are involved in the beta cell destruction. Beta cell destruction is the result of infiltration of cells into the pancreas and releasing of cytokine through an inflammatory process that could be more or less extended in the pancreas. So that also is relevant because according to the inflammatory process, the destruction of the beta cells could be more or less extended. Therefore, that has implication for what's going to happen after diagnosis, where patients already start their insulin, but need to be well controlled, and well-controlled patient means less complication in the long term. And to be well-controlled, patients should be treated with insulin, but also should have some reduction, some persistency of their beta cell function. And to protect the residual beta cell function, we intervene by controlling the inflammatory process. And Ladarixin has an effect by inhibiting some specific receptor present on the target cells, and therefore the main effect is the allosteric inhibition through modulation of the CXCR1 or CR2 receptor, where the interleukin 8 binds. The interleukin 8 is a cytokine that has an inflammatory process and destructive capacity, and therefore by interfering with the binding of IL-8, this is how Ladarixin works. And by doing so, it may reduce the inflammatory process within the beta cells. No, means that the drug is given orally, and so this is a great advantage in these patients. Second, the adverse effects were really not observed. The patients actually had, compared to placebo, the same sort of compliance to therapy. So it is, from that point of view, very safe and then very well accepted by the patient. So that is another advantage of this drug. The fact that in the trial, the patients were treated only for 2 weeks and got that results is quite encouraging, in particular because it protects those patients with an extended beta cell destruction, that are patients that are affected by apparently a more negative process in terms of beta cell destruction. So by protecting in particular these patients, it would have an effect that could be very positive on the future for this patient by preserving the beta cell function. This has been done up to 1 year, and so the new studies that will be performed, a phase 3 trial that will start soon, will actually be extended with the treatment being given for longer, and of course that is really what we expect in the phase 3 trial, to see the long-term effect of this drug. We expect that looking also at the secondary endpoints that have been met, that means reduction in insulin dose and also less hypoglycemia was observed with patients treated with Ladarixin. What we expect is that the patients are better controlled, that means lower HbA1c, have less hypoglycemia, and have some C-peptide that is preserved as long as possible. The preservation of C-peptide is actually important in terms of preserving patients from developing complications. From the DCCT trial, we know that if you keep a C-peptide above 0.2 nanomolar, patients are protected from developing complications.